Should I start?
Yes, yes, sir.
Yeah.
Yes, sir.
First of all, I extend profuse thanks to all of you, especially my very scholarly colleague, Dr. Lokendra Sharma, who's connected me to you people. So my thanks to Dr. Lokendra and my thanks to all of you for having invited me. Now, before I start talking about the educational impact or psychosocial impact or impact as a whole of COVID-19, we need to understand what this is the reason for impact and why this impact came into existence. I give an example that before the COVID was entering into India, even in month of January and February, we heard and read so much about the causes of damage COVID caused, so we were worried. Our fear psychosis as a consultant and doctors was also on the peak in month of first week of March. But over the period of time, you look, 4 months have elapsed. We have learned more about the COVID. We have learned more how to handle COVID. We have saved more and more lives. And hence our fear psychosis, which was very at high pedestal, has come down. So what the reason of all this, what we are talking today, is to have the genuine update and knowledge about COVID-19. So once you have a good knowledge about it, once you know the facts about it, you will be very confident not to worry and not psychosocially affect yourself. I give an example. Suppose you are in flight. There is some turbulence in flight, and there are two situations. In one situation, pilot says, just don't worry, you land safely, bear with this turbulence, tight your belt, you are at peace. Because the end result, pilot says that we are going to land safely, don't worry. The another situation is that pilot says, it is beyond my control, I'm not able to handle it, and probably I don't know what is going to happen. And then the fear psychosis sets in and everyone is stressed out. So on the day one, when the first COVID patient happened, it was a situation like second situation. But over the period of time, unparalleled effect of government, unparalleled effect of all of the involved agencies, especially the medical professionals, the police, etc. The way we have learned about the causes of pandemic and way we have handled it, I can reassure you that we are in a first stage with not to worry. Before I talk about the issues which is arising from this pandemic, I would share some facts so that more than half your worries, your stress, your depression will go away when I share facts with you. The facts are that 80 out of 100 patients who gets infected with COVID have mild symptoms or no symptoms. So it has no consequences and it doesn't bring any significant sickness and it doesn't endanger your life. So look here, 80% are safe. Remaining 20% pose challenge to the society, out of which 15 to 70% might have a disease, might have pneumonia, might have some complications of COVID. But with the understanding of disease, with the new modes of treatment, you must have earlier heard that COVID means lung pneumonia. But now we have discovered that COVID infection not only causes pneumonia, it makes some clots in the lungs, it makes some chemical to release known as cytokine, it causes the hardening of the lung. So we have understood all the causes which can cause mortality or morbidity in patient, and we have learned to treat them, and our results of treatment have been phenomenal. So another 15 to 17% people, though they require assistance, but they are recovering. So 80 mild symptoms or no symptoms, 15 to 17% requiring perfect treatment and they're getting better. Only 2 to 3% people who are elderly, who are our parents and grandparents, who are 60 plus and who have comorbid conditions like diabetes, heart problem, the cancer, the asthma, they are people at risk. But if these people also, along with all the 97, follow the 3 protocols of masking, the social distancing and hand washing, then probably we can protect them also. So another important thing is that, so you need to be very sure that we have understood the disease well. 80% have no risk, they are mildly or asymptomatic. 15 to 17% who have a moderate disease might require hospitalization, but they also get cured and treated. Only 2 to 3% people, that too also if you report early, take medical help early, you can protect them. So I must reassure you, that definitely this pandemic has caused a lot of stress and tension, but we need to be very intelligent. Every cloud has a silver lining. Every difficult situation has a silver lining, so which I'll talk to you later. So as COVID-19 pandemic continues to expand in India and in the world, only one thing is certain: the current outbreak will have profound impact, not impact, not only on our physical issues, but a lot of mental and social things we need to be very careful about it. The economic situation gets affected, but also on the psychosocial well-being of various societies and of the nation at a large also get infected. So you need to be very careful. Most of the nations across the world have implemented complete lockdown with stringent social distancing. You have gone through this phase, which ensures for breaking the chain of transmission of COVID-19. But it has got its own outcomes. The current outbreak of COVID-19 is heavily impacting the global health and the mental health. Make sure. But here I must tell you that once you have a reassurance that your health is going to be protected, well taken care by medical facilities and knowledge available, so your mental health should improve and mental agony should come down. Despite all the resources employed to counteract the spreading of the virus, additional global strategies are needed to handle the related mental health issues, which is very important. This outbreak is leading to additional health problems, such as all of us are facing stress, anxiety, depressive symptoms, insomnia, denial, anger, and fear globally. But I must share with you, having heard my first statement that the percentage of people are going to improve, they are going to recover, I hope all these symptoms should get diluted. To protect people and prevent the spread, it is critical that public mental health paradigm and measures are used carefully. The country remains vulnerable towards COVID-19 given the high population density. You know, we have a very high population density. We are almost 8 times the US population. We are almost 30 times the Italian population. The socio-economic fabric and overstretched healthcare infrastructure are certain very peculiar to our country. The total lockdown was the only immediately available, best and the ideal solution to control COVID-19 pandemic in India. Here, I would like to reiterate, many people are not so comfortable. They are critical. It affected the economy. But I must tell you, the total lockdown was the only immediately available, best and ideal situation to the control COVID-19 pandemic in India. If you are healthy, we can re-establish our economic losses. But if you are unhealthy, no one can do better in later life. The social and economic issues due to COVID-19 pandemic will result in mass unemployment. That might happen because of the lot of industry closure, the business closure, etc. But don't get disheartened. Depleted social network, safety nets can also be affected. It may increase homelessness. It may increase in gender-based violence. It may make people resort to alcoholism, cause hunger, loan defaults, and millions of slipping into poverty. This could be outcome, but public at large has come forward to overcome this stress, which is beyond anyone's control. It is beyond the control of government, administrator, public at large. So we need to all come forward to meet out these social accidents which might happen with the COVID-19. This post-COVID landscape will definitely lead to an increase in mental health, stress, anxiety, depression, alcohol dependence, and self-harm. Recent evidence in psychosocial sciences also show that similar pandemics of symptoms of post-traumatic stress disorder, as well as confusion, feeling of loneliness, boredom, anger during and after quarantine may happen. But I reassure you, we can all tide over by very good counseling, updating the exact knowledge. As my dear previous speaker said, infodemic, which is a very relevant term. Otherwise, I would also use a term known as University of WhatsApp. I must share a very interesting instance with you. Recently, I was traveling from Calcutta to Jaipur. I was surrounded by, on the both the side, two gentlemen, few in front and back were also their friend. Throughout my journey from Calcutta to Jaipur, they were talking about COVID-19. And as a doctor, I realized how less I know about COVID-19 by my all fellow passengers are loaded with information. So make sure that you make some genuine input from some doctor friends and feel confident from the information I gave you. That will definitely take care of your fear psychosis. A small team of peer counselor work under a local administrator and trained on community mental health issues is very important. It is time to build mental well-being and resilience into schools, the community, and their families. We need a systematic approach to build the demand for mental well-being, which is very important. The Government of India's Rashtriya Kishore Swasthya Kalyan National Adolescent Health Program, there's a Government of India running a National Health Adolescent Program, which can play a very important role because most vulnerable age group is adolescents. They have a half-cooked knowledge, may play a pivotal role in social and behavioral changes and enhance adolescent resilience against the mental health challenges posed by this pandemic. India can end the lockdown now. Additional revenue available for revival of the economy can be spent on increasing testing. Look here, we were having hardly any facility for testing. Today we are doing lakhs of tests per day. This has been possible because of the great endeavor of our nation, our government, our prime minister, and this will help to reduce the psychosocial issues related to COVID because more and more testing is done. People turn out to be negative, they become confident. Isolation of facilities, hospital beds, critical care, and comprehensive approach which is available, which make people very confident. Information, education, and communication, IEC, on the social distancing and mental health, addressing the mental health issue of vulnerable population under this lockdown is very important. The country can gain much more through continuation of bans on mass gathering, which is very important, school closure, restriction of movement of the elderly population and children below age of 5, covering the mouths and noses in public still should continue to lead a healthy life. We need to learn to live healthy and happy for at least 1 year more. Don't be dependent, don't be lax in your approach that vaccine is coming. Even if the vaccine comes at the end of this year, it will take few months for immunity to develop after you get vaccinated. You need to be very careful about spitting habits, physical distancing to extent possible in the public places, and expanded testing. All are going to reduce your physical and mental stress. Mental health support follow-up should be provided even 6 months after the release from isolation for those individuals. Why I'm telling you, a person who has been admitted, person has been put on quarantine, even should be followed for next 4 to 6 months. How is he doing to relieve him of the stress? And he need to be very careful about it. In the current context of lockdown, which is now almost over, and restriction of movement, children have constrained access to socialization. I'm more worried about psychosocial and issues in the children. Children play not possible. Their access to socialization is not possible. Even physical contact, critical for their psychosocial well-being and development, is missing. School closure are preventing children from access to learning and limiting their interaction with the peers. Children may feel confused and at loss with the current situation, leading to the frustration and anxiety, which will only increase with their overexposure to mass and social media, especially among adolescents. That's why I would be very keen to tell all of you that all the children at home, make them understand that what is the truth, give him a brighter side of situation, give him a statistical that if we take care, you will not suffer. It is a time to sit with your children, spend more time while talking, more time having breakfast, lunch and dinner together, more time watching movies together, more time sitting and gossiping together, more time helping them to study together. Probably, as I told to you in beginning, every cloud has a silver lining. This difficult situation has given a more chance to be with family, with our children, with the elderly people. There's a more strong possibility of grandparents interacting with grandchildren. So we need to take care of these issues which might arise because of this COVID-19 in children. Some adults may struggle to find ways to explain and communicate with the children about the current situation in a way that it is understandable by this age group, which will add frustration and this attitude in children and adolescents. We need to be very careful about it. COVID-19 is also bringing new stressor on the parent and caregiver. It is not only stressful for sufferer, but for the parents and caregiver. This can hamper their capacity to provide care and remain engaged with their children. Being very keen observer of people and environment. Always remember, children are very keen observer of people and environments. Children will notice, absorb, and react to the stress in their caregivers and community members, which unavoidably will affect their well-being. So always remember, you need to be de-stressed, parents need to be de-stressed, community has to be de-stressed, because children who observe them, and they will go into the psychological trauma. And the above is the only beginning. Level of stress will exponentially higher among vulnerable families. You need to be careful about it. For children who are deprived of parental care in child care, in situation or in alternative care, children living in the streets or children migrant and on move, for example, the situation will practically challenging for all the children of the different state of the society. Prior experiences in the public health emergencies have demonstrated that there is a high likelihood of an increase of violence, including gender-based violence, domestic violence, or corporal punishment against children and women. With the current movement restriction, girls and boys victims of violence will face obstacle to seek out for help and have access to support system. So I would be very particular to tell all my friends here that make sure, give a very positive information to children, spend more time with them, spend time in teaching them and educating them, reassure them that all are going to be healthy, we are going to tide over crisis. And the another silver lining is that all of us learn discipline. Cross-section of society has learned discipline about the social distancing, queuing at the shops and grocery shops, spending very carefully not to spend or not to waste the money to spend, and children will learn how to take care of parents and grandparents. Childhood is a critical period in any human's life, which marks the foundation of the person's personality and emotional resilience capacity of any person. In these difficult times, let us all commit to mitigate the effect of COVID-19 on those who deserve the most protection, the children. So I would conclude my talk with a suggestion that for your knowledge, most of the people are asymptomatic, 80% to not to worry. 15 to 17%, they have medical issues, they are very treatable. 2 to 3%, we need to be very careful, and to overcome the stress, we need to report to doctor early and to protect them by 3 standard protocols of masking, the social distancing and hand washing. And above all, rest assured that as the period passes, we become more used to handle the COVID. We only need to be very careful about it so that our social and psychological stresses are not there. Regarding education, probably in a defined way, because the congregation, classrooms, and the big halls and prayers and meetings and lectures have to be avoided because they are very contagious situations. Hence, you need to have the best out of your online and in-house readings, and you need to be careful about it. Lastly, I would like to just bring to the notice of a student that many people ask, why mask? Why mask? I must share with all my student colleagues that suppose I'm COVID positive, if I'm talking, I'm throwing 20 to 40 viruses per minute in the atmosphere. If I cough or sneeze, I'm showing 20 million, 2 crore viruses in the atmosphere. And you require only 1,000 viruses. You require only 1,000 viruses to inhale to get the disease. And that's the reason, dear friends, that have the mask so that accidentally if you have a infection harboring as asymptomatic COVID, you don't infect others. Secondly, why mask is important? Suppose someone is coughing who might carry the viruses, so you don't let the viruses enter in your mouth. Why distancing? Because when someone coughs or speaks, the viruses goes up to 3 feet, then they fall down. So if you keep a longer distance, you don't expose yourself. And why hand washing? Because these viruses, when they fall on solid surfaces, like they've fallen on the table of your college or library or on the restaurant or the railings, we touch our hands. This virus remains alive on the hands if you not wash for 24 to 48 hours. So you may touch your mouth and nose, etc. So dear friends, dear colleagues, dear children, I reassure you, having known the statistics of disease, rest assured, definitely we have in a pandemic, but we doctors, the medical fraternity is there to make you feel better. So don't get a psychological depression set in, number one. Number two, you need to follow these protocols. You need to be mentally prepared few months and years so that we don't have increase in the disease pattern. Thirdly, always be hopeful that this is not end of everything. It has made you more disciplined, have more family oriented person, spend more time with your children, and try to find out what is the best of a given situation that you must have never taken all the 3 meals with your parents and grandparents. That is the best way to elevate the stress and tension. Now, regarding education, I would like to share with you that education is a level of self-knowledge. You definitely like teachers, you definitely like the people to mentor you, to guide you, but you can continue to acquire the self-knowledge by your self-reading, online reading, connecting to all your mentors online, and continue to do. In fact, I must share with you, in our medical college, physically, when we used to have classes, there used to be attendance never more than 50%. Dr. Lokendra will agree with me. When we started taking online classes, 95 to 100% people gets connected. There's a better interaction, more questions, and more abilities of the students we come to know about it. So definitely, in a given circumstances, we need to improve little educational pattern, but I'm only concerned more about children, because in children, especially those who are from age group of 5 to 15, they are so raw. They are like a plain paper. So they need to observe more happiness. They need to observe more confidence in learning the COVID. They need to observe the gloomy society. They need not to see the gloomy society and gloomy people, all right. They need to be taught about all these social protective measures, that is SMS, that is social distancing, mask and sanitization. And they are the one, they could be our role model to de-stress society, de-stress colleagues, give a positive feeling to all the colleagues and all the people around. That's all what I would like to say as a doctor. And I'm really thankful to all of you to having invited me. And it's a wonderful endeavor and wonderful, I think, endeavor of yours to absolutely disseminate among knowledge among your colleagues in institute.
Thank you. Thank you so much, sir. Thank you so much for your valuable talk. Am I audible to all?
Yeah.
Yes, audible.
Yes, audible. So we have an announcement. After this, once we over with this speeches, we're going to have a panel discussion from 8 o'clock to 8:55 p.m. So please stay connected with us. So moving ahead, now I would like to call our next resource person. Before I will call sir, I would like to give a very brief introduction about sir. Dr. Vimal Kumar Sharma sir is a vice chairman of a Global Rural Mental Health section of World Psychiatric Association. He served as a medical director and a director of research for CWP NHS Trust. He also served as a deputy leader for Northwest MHRN Hub and Royal College of Psychiatrist Examiner. So we are very privileged to have you, sir, this evening. So, Vimal sir. Over
Okay.
to Vimal sir.
Yeah, thank you. Can you all hear me?
Yes, sir.
Okay. Well, thank you, and thank you for organizing
Welcome,
this
sir.
meeting. I see familiar faces. Dr. Sudhir Bhandari has given us a wonderful talk, and we work closely with SMS. And I think just to disclose some secret, that 4 of us are from SMS Medical College. Professor Bhandari, principal, Dr. Anil Sharma, he's in the United States. Dr. Lokendra, who organizes these educational programs and takes a lead on education in SMS College. And we work very closely with SMS College and in Rajasthan for mental health, and in other states in India as well, besides other countries. I'm based in the UK. I'm speaking from the UK. So thank you for allowing me to share some of my thoughts with you. Dr. Bhandari has already outlined, and I'm delighted that even being a physician, he was able to address mental health issues in such a lucid and clear ways. And therefore, he hasn't really left much for me to say. And we have other eminent people like Dr. Anil Sharma, who will probably highlight some of the specific issues. But I thought I'll just briefly outline, based on evidence so far globally, how does epidemics impact on mental health and well-being. And the first thing is social isolation due to lockdown. Now, it's important to understand it causes obviously negative emotions, but what are the factors which lead to these negative emotions or adverse impact on mental health? And obviously, it is related to stress. And the stressors are longer duration of social isolation, fear of infection, then frustration and boredom due to not able to do things which people normally do. For instance, traveling, seeing friends, having parties, going to weddings, going to cinema, etc. Sometimes pandemics may lead to inadequate supply of stuff you want to get, information or lack of information or misinformation is a big issue. And I think as COVID-19 progressing, we are learning new and new things every day. Financial loss and stigma attached to infection. Now, I think learned people who are here, I don't think they're worried about it, and people elite probably not worried about COVID-19. But look at the community. I think if you go in the community, people still have fear and they try to hide their problems. And if they have some symptoms, they worry that what will happen if we disclose to specialists. So all these things lead to stress and lead to adverse effect on mental health and mental well-being. Now, the second important issue is that due to this ongoing or significant stress, it may lead to mental health problems, or it may worsen the mental health problems, those already suffer from it, or it may precipitate mental health problems who are vulnerable to or prone to developmental illness. And obviously, these excessive stress may lead to depression, anxiety, substance misuse, post-traumatic stress disorder, suicide. And I think another important thing is quite complex grief reaction, because in many situations, people were unable to see their dear relatives when they died. They weren't able to do their last rites in a proper fashion. And sometimes they had to live with that kind of guilt for a long time. The people who are hospitalized and suffered from COVID symptoms, and especially in earlier phases where there weren't sufficient or enough treatment to overcome those symptoms, they are more prone to develop mental health problems. And I think one of the things is for those who were affected quite badly by COVID, we don't really know what will be the long-term consequences, both in terms of physical state as well as impact on their mental health. The other important thing is the relationship between economic downturn and mental health problems. That is very well established, whether it has been due to any kind of pandemic or even due to economic recession due to other reasons. For instance, in around 2008, we had severe economic downturn. And especially in the Western world during that time, there was an increased rate of child abuse, domestic violence, substance misuse, suicide, and mental disorders in general. And I think there is a risk that the consequences of COVID pandemic may lead to economic depression in almost all countries, and that may lead to adverse consequences of mental well-being and health. It's important to recognize that specific populations like elderly population, which are more prone to develop anxiety, depression, frustration due to social isolation. Obviously, they have increased fear of having adverse effect of COVID. Children and younger people, as Dr. Bhandari already highlighted, that longer term staying away from school has adverse impact, boredom, and it may lead to conflict in children. And I think I wouldn't really go in more detail, but that remains a vulnerable group of people, and one has to keep them in mind. The frontline health workers and frontline workers in general, they facing quite difficult situations, obviously add to their stress. And sometimes these significant events stay in their mind, worrying them and having a sort of longer term consequences. My son is working as a registrar in emergency medicine in Melbourne right now. And he was telling us that sometimes they had to made quite difficult decisions when people in severe state came at the front end. And obviously he was quite distressed and disturbed as a result. And I think many frontline health workers face these challenging issues. Even in India, in some of the cities, there are lack of beds, for instance, where there is certain rise of corona cases. If I talk briefly about people with mental illnesses, that mental health services always been inadequate to provide fully fledged services to all. There has always been a treatment gap highlighted by WHO. But with this additional stress and resources diverted to physical health and other areas, I think people with mental health problems are even, there is a risk of them getting left out. And I think because of lack of availability of services at present, there is a risk that people may be left suffering for a little while, and that may make them at a sort of severe state before they get attention from services. I think I would very briefly outline that what we have to focus on, in other words, what should be the recommendations or solutions of these problems. Obviously, you need funding to provide adequate resources and money in order to provide services to people who are adversely affected through the pandemic. But importantly, you have to provide access to services. And I think in that way, one of the things here in the UK, we learned during COVID pandemic, that the family doctors, they didn't need to see people face to face to avoid catching infections or passing infections. And most of the consultations were done through either telephone or video conferencing. And that became so successful that the health minister now recommends that this practice must continue. And I think using technology, we can access to many people in providing services. We have to focus on supporting frontline health workers and also vulnerable groups like elderly and children. The important thing is training in mental health. And as Dr. Sudhir Bhandari pointed out, and I was quite impressed with his due importance given to mental health by him, is that training of mental health, in my view, must be provided to all health professionals, a basic training. And this is an area where we have been working for a number of years, and I'm sure Dr. Lokendra will highlight that in his presentation. So I'm not really touching that. Prevention and public health education is important. And all talks about how to manage stress, how to make life more worthwhile, how to live happily. We have talked about this, and I think I'm not really going into any detail of that, but I think that's important. But equally important is making public aware of mental well-being of population, how pandemic affects mental well-being, and what are the ways they could be helped to prevent. But if they suffer from any consequences of mental health problems, then what should be the earliest possible solution to them? I think the important thing is it should be an integrated public health strategy from central government to a local level, where mental health becomes an integral part of overall health services. And I think with IT people, I'm quite delighted that Institute of Technology is giving due importance to mental health and well-being. And I think I will stop that unless there are any questions, because I'm aware of the time. And we have other experts who will probably share their expertise in their presentation. Thank you.
Thank you so much, sir, for your illuminative lecture, sharing with us. So we have a panel discussion around 8 o'clock, 8 to 55 p.m.
Sure.
And so in that time, we will going to take a question answer round.
Okay.
So moving ahead, today we have our Next resource person, I would like to read a very brief introduction about sir. We have Dr. Anil Sharma sir, who is a board certified psychiatrist and clinical pharmacologist, expert in psychotic disorders, addiction, and substance abuse. Dr. Sharma sir holds a various medical director and chairman positions at inpatient psychiatric hospitals and substance abuse programs. With more than 25 years of medical experience, Dr. Sharma sir serves as one of founding partners of Escalate Research Centers located in Panorama City, California. He is committed to advancing the care and treatment within the medical health arena. Sir, over to sir.
Thanks for a nice introduction.
Thank you, sir.
And it was
Welcome.
great talk by Dr. Vimal Sharma and Dr. Sudhir Bhandari, and I'm very fortunate to be on the same platform as our professors to talk about what's going on. So as you know, COVID-19 is not normal times. These times are very special, very special pandemic in a way, very scary, but things can get better if we all take precautions, as Dr. Bhandari and Dr. Bimal Sharma stated, like importance of mask, distancing, following up with your doctors. Personally, I know people, my friends who were first-line providers got infected, and even some people we have lost in this fight. And it has been very difficult for providers themselves, because we have to take care of our patients and we have to take care of ourselves too. And it's affecting us in different aspects, physical, financial, psychological. All these fronts are getting affected. I came across a very good study from a Chinese university about SARS. The study indicates that even when COVID situation will be under control, or COVID one day will disappear or go away, unfortunately, mental health issues would last much longer than that. So that study talks about SARS. If you remember, SARS epidemic happened in about 2003. And after SARS was under control, Chinese university did a major research project, and they found about 40% population of Hong Kong were affected by mental health sequelae of SARS. Most common was anxiety and PTSD, or post-traumatic stress disorder. COVID is on a much larger scale than SARS. SARS was very focused in some Asian countries, but COVID-19 is a true pandemic. Every country, people from every walks of life are affected or infected by COVID-19. So of course, we will have problems way longer than the physical aspect of COVID will last. What kind of problems? As you know, most common reactions are stress, increased anxiety, depression, and PTSD. As Dr. Vimal Sharma report stated, there's already stigma to mental illness, and now in this time when it's very difficult to access healthcare, this stigma is even tenfold. People who are getting affected by COVID-19, or their family members are getting affected, they are in that phase. Either they are experiencing guilt that they cannot be there for their family members. They are under a lot of fear that they themselves may get infected or may transmit this infection to their family members, their elderly family members, or their children. Schools are shut down, but eventually schools will open, and we will have another wave of fear or stress or anxiety. Financial anxieties are there. And I know that governments are helping businesses and other people to go through this process, but as individuals, we have to be prepared for these difficult times. And how do we do this? In mental illness, there's a big role of group therapies, individual psychotherapy, being there for your patients. And in this time, even that's not possible. So we are utilizing a lot of telemedicine or telehealth. We are seeing patients, even I'm rounding on inpatient unit using telehealth. Some patients, we are seeing them on telemedicine. And in psychiatry or even in other fields of medicine, the connection with patient is more important. Even if it's through the technology, you can still make the same kind of connection and make an impact on their mental illness and their treatment. People who already have mental illness, they have other problems like getting their medication refills, getting their psychiatrists or therapists see them on a regular basis. People who have no mental illness, first of all, they have to realize, because in any mental illness, there's a stage of denial. Initially, we said, well, it cannot happen to us, but it can. So seek help. Unfortunately, this time, not a lot of psychosocial support is available in terms of physical support, being there for others. Humans are social animals. We like gatherings, we like people around us, but in this day and age, social distancing is so important that we cannot even see our near and dears. So we are using technology a lot. As you know, treatment of anxiety and PTSD, group therapy, cognitive behavioral therapy play a major role, even more than medications. So we have set up some support groups, which are virtual online support group, trying to create awareness and trying to join people so that people can learn from others' experiences. How are they coping with it? So in one of the initiative is called wellnesshelpline.com, where we are trying to build larger support groups across the globe, in United States and India. In India, we only opened up for frontline providers like physician, nursing staffs, and ambulance person, but we are planning to open it to general public so more people can join these virtual support groups and able to help each other by our experiences. Children are getting affected, and that's a completely different situation because kids at different ages, they have different ways of learning or different ways of processing. If you have very little kids, little children, they do not understand what's going on. They know that they are not going to their daycares or preschool. So you can sit down with them and explain in basic terms that there's an infection going on. We are trying to avoid all the physical contacts because this virus jumps from one person to another, or it can be transmitted by touching the same surfaces if an infected person has touched those surfaces. Problem is, kids who are older in terms of teenagers, anywhere from 14, 15, 16 years of age, because in their lifestyle, social interaction was so important, playing sports, going to schools, going out with friends, and they have difficult time understanding why they cannot lead a normal life at this time. As kids, they always think that they're immune to everything. So our goal is to provide some education to them in age appropriate manner so that they can understand what's going on and how they can prevent themselves and others. Okay. Substance abuse and domestic abuse are another major problem which happen during any pandemic. People are at home, they are working from home, and rate of tobacco consumption, alcohol consumption, and other drug consumptions are going high, which are creating other problems. Domestic abuse, because people are in the four walls more often, more spousal abuse, more child abuse cases are coming forward. Also, people who have chronic medical conditions like diabetes, heart conditions, just remember that heart attacks and strokes don't go away in pandemic. You still have to take care of yourselves. Make sure that you have enough medications at home. Make sure you are still controlling your diet and exercise. And speaking of exercise, I do tell most of my patients it's one of the great coping mechanism. People who are stressed out or high level of anxiety or depression, other than counseling, getting support from family members, exercising and a balanced diet is very important. In some people, all these methods may not be enough, and they may need medical or psychiatric care in terms of medications. So just remember that there's help available. Each community has these doctors or psychiatrists who are still available by phone or by telehealth. So please make sure that you reach out to them. We are still seeing a lot of patients, and I see patients who are either affected by COVID or their family members are affected by COVID, and we are trying to provide them more psychosocial support system in terms of education, because there's so much misinformation out there, as Dr. Bhandari mentioned, and Dr. Yadav said, there's an infodemic. I like that term. There's so much misinformation. All of a sudden, everyone is an expert in COVID and pandemics. So try to get your information from the right source, from the valid sources like CDC, WHO, ICMR. Each community has valid sources of information rather than getting all your information from social media, which is difficult in children or adolescent of teenage years, because they are very well connected to social media, and that's where they get the information. But as a parent, you need to sit down with them and explain that what all information you are seeing in media may not be true. So go to the valid source of information to obtain your information. Also, there's flooding of information. You open the newspaper, you go on any news website, most of the news are pertaining to COVID, which of course is important because that's a pandemic, had affected more than 4 million people in the United States and all other countries. It's a good number of people who are affected either directly or indirectly. Indirectly, it's affecting pretty much all of us, in terms of financial difficulties, in terms of, our family members, our friends getting infected, and this fear of getting infection is huge. So it is affecting us, and the thing is, how do we prevent? What can we do in this time? As I said, reach out to get valid information, reach out to your family members or friends for support. You may get information which may not be true, but if you sit down with your family members, you can get the right information, or go to the valid sources like CDC, ICMR, etc. Please support us in our initiative of making this virtual support groups at wellnesshelpline.com, which we'll soon open to general public in India, so people can support each other. In PTSD, normalization is one of the process in recovery. We learn from others who have already processed and learned some coping skills, and we can learn from them, from how they are coping with the illness, and the whole community can be benefited. With this, I think my time is over, so I will hand it back to our moderator, and will be available for question answer session.
Thank you, sir, for an enlightening presentation. So in this process, now I would like to call Dr. Lokendra Sharma, sir. We have our next speaker. Before calling sir, I would like to give a very brief introduction about sir. Dr. Lokendra Sharma has published 50 national and international research articles, and he has presented his research work in international conferences in Australia, USA, Vietnam, and Japan. He is working in international collaboration with Manchester University, UK on numerous projects. He has received prestigious WHO fellowship. So over to sir. Lokendra Sharma, sir.
Thank you, Dr. Lakshman, for inviting
Welcome,
me. Just I want to share my PPT. Basically, we are involved with global mental health assessment tool for so many years, and I hope this in crucial time, this tool is basically helpful. We are also try to think that this global mental health assessment tool training for medical students and all other students, it can be beneficial for present situation, which is, I think, very difficult situation as far as this COVID adverse disease reaction can term we can use this post-COVID scenario. We are also have jointly working with number of mental health project with Manchester University, where the Dr. Vimal Sharma has already told us so many current issues related to COVID. And we also have working with Dr. Anil Sharma, and we are trying to develop some wellness website with Dr. Anil. He is working in UCLA. And India, we are different consultant of our SMS alumni in Rajasthan also. We are also supporting development of wellness website, which is very helpful in present situation. And I want to tell you about this global mental health assessment tool, which is basically mental health assessment that is computer assisted, clinical interview based, and use it is in clinical practice by day-to-day by health practitioners or healthcare workers. And from so many years, we are also training. We are also training medical students from last 4 many years with consultant of psychiatry, Dr. ID Gupta sir, and department head and students. They are also supporting us for training of medical students. Basically, in this tool, this is a rating system or score system is there. If patients have some any illness of stress, anxiety, which is COVID phobia, any type of symptom, is suppose there is rating system is there, 0, no symptom, 1 system, and 2, 1, 2, 3, and 8 and 9. This is other rating system of COVID. Then this is basically we can download this tool from www.gmhat.org, and this is free of cost. This is developed by Dr. Vimal Sharma. This is basically assessment of adverse reaction of stress level by yourself, and this we can use for this teleconsultation tool for support also. And Dr. Vimal and his secretary consultants, they are using this tool from homeless persons, mentally health, the well-being of these. And this is amplify a positive and hopeful story. If suppose anyone learn this tool, and it is definitely help in improve their positive thought and well-being, and we have to involve educate students for some try to learn and try to involve some positive story and positive news from media. From this, as far as this tool is concerned, we have this initially that when open this tool, there is instruction in this tool is there. After that, we have to have consent form, which can take consent of patient or healthcare worker. Then these are the questions, different questions of all different anxiety, multiple questions. On the basis of that question, anyone healthcare worker or anyone can go through particular disease and try to understand disease. And even if suppose anyone is involved in learning GMAT tool and using global mental health assessment tool, is able to identify a disease. If suppose any person is identified disease of his herself or their relatives or their friends, this is very helpful as far as this mental health program is concerned. We are also working this global mental health assessment tool from last so many years, from like 16 batch, 17, 18 batch. Then we also try to involve this tool for in traditional teaching also, for integrated teaching also. And we also use this tool for different postgraduate students and in different like cancer patients, tuberculosis, and asthmatic respiratory disease patients. This tool is very helpful as far as the stress of different disease is concerned. We also taking few studies in COVID period also. We also using taking help of Telegram and WhatsApp in for GMF training. This is as student you know very well that is Telegram is cloud-based system. So we take a group, make a group in Telegram and WhatsApp, and this is Telegram is available in the all applications and what mobile application also. So this is a message exchange, and we have make a group just educate and training students in different groups. So we also recently conducted some studies in COVID patients. They try to assess the level of depression and mental illness in COVID patients, their relatives, healthcare workers. All these we have number of studies. We are our students and our department of pharmacology conducting in a state, national level also for stress of online stress during lockdown, post-lockdown period, and in students of stress of examination, with lots of issue of examination also. With Dr. Vimal and Dr. Anil, we try to develop COVID social support system also globally, involve several doctors from different countries just to provide support to all these healthcare workers, their relatives, and patients also. And we also try to develop paperless activities for hydroxychloroquine pharmacovigilance during COVID period. The purpose was just to remove stress amongst healthcare workers involved in management of management of COVID patients and their families. We also have some certain online activities like continuously doing webinars for different college in Indian college in Rajasthan, medical college, and we're using the social media and media newspapers for supporting and popular for increase awareness and involvement of patients and healthcare worker for psychosocial support systems. We also try to use Facebook and other social medias for support of psychosocial support and awareness, positive awareness of COVID, and just to remove COVID phobia in general population and healthcare workers. We are also using some good platform for this conducting regular webinars of our institute and in Rajasthan also. So we have developed one book and chapters in this uh, global mental health assessment tool with the help of Dr. Vimal, I.D. Gupta sir, and Dr. Kusum Gaur. We have tried to involve our teaching by using integrated teaching in our student training programs, training themselves, improve their clinical exposures. You have a good publications of how we can use acupressure points to reduce stress. The certain points which can be used. We have conducting this type of study also is also helpful just to remove stress amongst students, patients. These are the certain acupressure points which are available in our website also. We can use these points just to remove a cope of stress, post-COVID stress, and stress during COVID periods. These are the some pictures which we at our college conducting jointly webinar with our Rajasthan Medical College Teachers Association and with other college and IIT regarding this. We have tried to create awareness uh, amongst uh, patients, students, just to remove COVID phobia. And thank you very much. We also involved in healthcare of Rajasthan. We have developed healthcare for COVID patients, non-COVID patients, and we are also conducting pharmacovigilance activities for COVID and non-COVID patients, their treatment and prophylaxis treatment and management. All over India, all pharmaceutical departments, they are involved in care of this. Thank you very much, and thank you organizers giving me opportunity to uh, give my presentations and our work with Manchester University and with jointly with Dr. Vimal Sharma and Dr. Anil Sharma. They are jointly supporting us during COVID period. We are regularly in touch with them. They are also supporting Apna Ghar type of centers in all over India and Rajasthan, providing healthcare facilities to
Pandemic conditions के बाद.
homeless persons. Thank you, sorry. Thank you very much, Dr. Lakshman. Thank you very much.
Thank you, sir. Thank you so much, sir. So, thank you for a valuable talk, sir. Now we will move for a panel discussion. But before a panel discussion, I'll ask Rachel to come in, please. Rachel. Audience can also ask their questions. If they have any questions, they can ask us. We are live on Facebook. We are also on Zoom. Neeraj.
Yes, sir.
Uh,
I think Rachel can take over.
Rachel is there.
Yes, sir. Yes, sir. I'm there.
So before panel discussion, I have to say a few lines. Just let me get in. Neeraj, are you there?
Yes, sir.
Please convey the message to Rachel.
Yes, sir. I would request Dr. Lakshman Yadav to share some of his thoughts. Dr. Lakshman Yadav has pursued his he has completed his master's in Institute of Medical Sciences, Banaras Hindu University. He is the on-campus counseling psychologist in the Indian Institute of Technology, Banaras Hindu University. I request Dr. Lakshman to please take over and share his thoughts.